Your general impression begins with that first visual of the patient. You're going to want to be looking for visual indicators of the patient's condition, using all your senses, checking for all the sounds, any kind of smells, everything you can see, such as the position of the patient's body, whether the patient's presenting with the levine sign, clutching of the chest, are they in a tripod position with an increased work of breathing, mostly just their overall general appearance, whether they're sick or not sick, and any kind of immediate life threats. Hi sir, how are you?
Oh, I'm having chest pains, man.
As you come in contact with the patient, one of the best things you can do is begin a conversation with him. Once you begin talking to them, you're going to be able to assess their level of consciousness, whether they're alert, whether they're only responsive to verbal stimuli, painful stimuli, or whether they're deemed unresponsive. Then also, once you begin talking to them, you're going to be able to assess their airway and their breathing, of how they're communicating, whether they're able to speak in full sentences, or whether that's only 2-3 word sentences, alluding that the patient is very short of breath.
Oh, it hurts.
My name's Ben. I'm an EMT with the Pierpont EMS department.
Okay.
So we're going to get you taken care of today, okay?
Oh man, it hurts bad.
After you've assessed the airway and the breathing, now you have to check circulation. On every patient, you need to be checking for a pulse. If the patient is alert, check their radial pulse. If they're unresponsive, check their carotid pulse. But you see in this video here, the provider is checking the radial pulse at the same time and checking for temperature of the patient, checking that skin, the collar, temperature, condition, and checking that circulation and perfusion status. And with that pulse, you're just feeling, does it feel regular? Does it feel fast? Does it feel slow? Anything abnormal with that pulse. Bad chest pains?
Bad.
Okay, well, based on your severe chest pains, I believe we're going to get you on the cot and get you out to the ambulance. The final step of your primary assessment is that patient priority. Is the patient sick or not sick? If sick, how quick do you need to go? Also, the other infamous saying is it a stay and play or a load and go situation? In this given scenario, a patient having severe chest pains would be a load and go, a priority patient.